Welcome to Focus on Health, a series of educational programs highlighting current health issues sponsored by the School of Nursing at Salisbury University. I'm Dr. Mary DiBartolo, Professor of Nursing at Salisbury University and host of the program. I welcome Dr. Kathryn Fiddler, Kathryn or Kathy. You are the Vice President of Population Health at Untitled Health.
Yes, I am.
So happy you could come on the program because I know myself, like many, would love to hear more about what population health means. It's like the newfangled term, and we're starting to hear about it more and more, and you are the Vice President of such at our local hospital. So thank you for coming on because we're going to talk about that and then how it's related to the COVID pandemic that we're currently dealing with.
Awesome. Thanks for having me.
I know. I'm so happy you could come in, and you're a proud graduate of Salisbury University.
I am.
From our undergraduate program, master's program, and our DNP program. And you were one of our first graduates, I believe.
I was.
So anyway, I think the first burning question is, explain to us, what is population health?
So population health really is just understanding what are the needs of a community, really on the healthcare side, whether it's health equity, social determinants of health, chronic disease, what are those things, and then what can organizations, health systems do to improve them? You know, for years it's been very much hospital focused. Let's have people come in the ER, people come into the hospital. But what we know, it's really fixing those things out in the community, the places we send patients to when they go home or the patients are coming from that really need to be addressed. So one of the ways that we figure out what our priorities are is to use something called the Community Health Needs Assessment. So every 3 years, us in conjunction with the health departments look at the community. We survey community members, we survey key stakeholders in the community, we do research on the data about healthcare things going on to understand what are the needs. And that's kind of the world that I manage on any given day, is what's going on in the hospital, but what are those pressing needs out in the community that we can really address longer term.
Well, I know, having been a nurse a while, it's always been a concern about that gap. You know, when someone leaves the hospital, making sure they have a discharge plan in place to where their needs are still met once they go back to the community. And then, of course, hopefully, it's so successful that they don't need to come right back to the hospital again, that we can keep them functioning in the community longer. So I guess you're looking at a variety of needs.
We are, and it even starts before that. So why did someone who's in the hospital for their diabetes that's out of control, what didn't they get in the community? What was it? Food insecurity? Did they not have the right place to shop for the food that they needed? Were they unable to access the healthcare system? Did they not have insurance? Did they not have a primary care provider? Did they not have enough money to pay for medications? I mean, there's so many things that impact people before they get to the hospital. So it's really looking at those things and figuring out if we can go upstream and start working on them to improve the whole population and not just one individual at a time. They always use that analogy, you know, a woman walking along the sea and seeing a bunch of starfish and showing one at a time, throwing them back in the water. But we really want to get all those starfish staying in the water. So what are the things we need to do to make sure that that happens?
Well, it sounds like it's quite the job, a monumental effort. And I know you have a team of people that you work with, but just give us an idea of what some of the things, what are some of the initiatives going on, aside from COVID, we'll get to that in a few minutes, just in general of promoting and maintaining population health, so to speak.
So we have several teams. We have a care management team, typical of many hospitals, but what you're talking about, who develop those discharge plans. So they start the process for people we don't have any experience with. They're working to identify, are there gaps, are there needs so that I can get folks home safely, either from the emergency department or the hospital. Then we have a whole other team outside the acute care environment following up with people. So if I've left the hospital but didn't have a primary care provider, we'll follow up with you, give you a phone call, make sure everything's going okay. Were you able to get your medicines? Do you have a ride to your next appointment? Then we have a group of individuals embedded within providers' offices. So we have partnering teams of offices in the community, our Untitled Health medical partner groups, as well as several other groups within the community, part of our clinically integrated network. And so we have nurses and care coordination specialists who are in those offices working to understand social determinants of health, transportation, financial resources, ability to get medication, food insecurity, things like that. And then nurses who can manage those chronic diseases longitudinally and get patients what they need for their care. So those groups are very structured and very traditional roles for care coordination. And then we have the community health team. And they, in the era of COVID, have had many hats. But what they do, we have a SWIFT team. So it's the Salisbury-Wycomico Integrated First Care Team. It's a paramedic. I know, that's a big mouthful, isn't it?
Yeah.
But it's a paramedic paired with a nurse practitioner, and they actually do outreach. We identify individuals who have called 911 several times over a short period of time, and they go out to understand, why are they calling 911? Typically, it's not for healthcare reasons. It's for all those other reasons. They couldn't get a ride to their doctor's appointment. They live alone. They might be lonely. They didn't have any food to eat. So we work with those individuals, make sure they get connected to a primary care provider, get them access to some of these other services that they might need. Oftentimes they have unstable housing. We're able to get them into housing and things like that. It doesn't happen overnight. It's been a long journey. We've been doing this since late 2017, but it's really pretty awesome, the work we've been able to do. We have community health workers. So they go out in the community. Oftentimes we identify people come in the ER and just the nurses are worried about them. Will they be able to follow up with appointments and things? So our community health workers will go out. They are trained as peer chronic disease education specialists, so they can do chronic disease education in the house. They can follow up on vital signs. They can teach folks how to use glucometers. They do a lot with housing applications, Medicaid applications, and things like that. They're just a phenomenal team. Then we've got our diabetes education team, a whole host of other individual roles that do a lot of things.
It sounds quite involved.
It is.
And what about, I know you mentioned chronic illnesses, and that oftentimes is our older adult population. So are you partnering with MAC in any way, or these organizations that help provide support services for that population?
Yeah, that's a really great question. So United Way and MAC are two of our strong supporters in both directions. MAC, actually, we help fund several programs for chronic disease education in the community. I know that's looked a little different in the era of COVID. Any of the falls prevention training, the PEARLS, the depression reduction program. So a lot of the stuff going on at MAC, as well as a lot of their other programs with older adults. So it's definitely a team that we reach out to a lot. We have, we actually integrate our EMR information with some of the work that they're doing, so we can send it to the state to show this collaboration with referrals. All of our providers that are in primary care that are partners with us know about the programs at MAC and have a referral sheet, so they can just send folks right over there. And they've been exceptionally successful and well received in the community.
Well, collaboration is key, and I know one thing you want to talk about is how well you're collaborating with the health department, of course, in this era of COVID. So before we get to what's going on with the plan for COVID and vaccination and so forth, talk to us a little bit about where we are with COVID in terms of the rates and numbers and so forth. I mean, we are in a surge right now, so let's just do an update on that. That's the not so good news, but the vaccine is the good news, and I know people are anxious to hear more about the plan.
Yeah, it's, as we all know so much about COVID now, and it's just funny when you think about what the common man knows about a viral illness. But when we saw it in March and April, we did a lot of proactive work readying the hospital and our staff and training everyone for COVID. And we had a lot of patients at that time, and it was very new and very frightening. Not that it isn't frightening now, but we've learned a lot of things. I do have to say TidalHealth was an early adopter of masks for everyone and really limiting visitors and things like that. And it's been a key to our success long term to keep staff healthy and safe. But what we found, because of Thanksgiving, people being indoors more, I think people being tired,
COVID fatigue, I
know.
know.
COVID fatigue. I just don't want to wear my mask anymore. I'm going to go in the wrong door in the grocery store. And but I think we're seeing a lot more people just wanting to get together. And the holidays are such a tough time because many of us haven't seen older relatives and other family. So we're seeing a huge surge right now, and it's putting a big strain throughout the whole country, but even on the resources here on the shore.
Because the Eastern Shore seemed to have lower numbers for a while, and now we're starting to creep up, close to 10% now, I think?
Yeah, it's 10%, 9.5%, 10% right now, and any one of the counties is similar to that. A lot of it is just timing. You know, we always follow behind the rest of the country, the rest of the state a little bit more. We are lucky because we are more rural, so we don't have large cities where people are packed together. So I think we have been protected in many ways, but it adds that other flavor of problems with transportation, problems with good food security, because we have a lot of our food sources are different now just because of COVID. You can't always get what you want at the grocery store. So a lot of those
paper
things,
towels,
toilet paper,
paper products.
I was at Ace Hardware the other day and somebody was pulling out a big thing of toilet paper. I'm like, I didn't even know they sold it here, but I figure they were probably trying to get it where they could.
It's a different world now, but hopefully we're going to see things wind down. And I know at the hospital, they are maintaining a higher census now because of the increase in cases and hospitalizations. But it's under control. It's just more of a concern in terms of the numbers of patients now, correct?
It is. It's a burden from just how do you staff that when, if I'm the nurse, I've got to wear all my PPE, I have to wear a mask and a face shield and gloves and a gown, and it's just a lot. It's not, we're very capable and able to do it, but people then need a rest and they need a break, and then they have to take all that equipment off. So it is hard. I can say that from a team perspective as Title Health, we've been proactive from the beginning, putting the tents out front early. Our emergency department team is just well led, well managed, and very proactive, and same with the inpatient. We have a fabulous CNO, Sarah Arnett, and then Ray Fulcrot up in Nanticoke, Title Health Nanticoke, who have done just an excellent job communicating, being very transparent about what is being done, and that communication has been key to our success. I'm certain of it.
I know I've been impressed. I know Dr. Chris Snyder, Dr. Mark Edney, they are all all in on getting this squared away, staying on top of it. And I think we're lucky in this community to have a hospital that does seem to be proactive and just handling it. So now we're kind of entering that phase, since we have a vaccine as of December. Of now we're on this new goal of getting people vaccinated. And I wanted to ask you about how things are going with that at Title Health in terms of, I assume you're doing your frontline workers, and so I'll let you take it from there. Give us the update on that.
Yeah, so similar to how screening started, in the beginning there was not a lot of tests, but people wanted to know if they had COVID. Well, we started at first just working with the health department. We had a call center, and then we would do some large clinics together in partnership. We approached vaccination the same way. The state, though, in the way that each state is being managed, had their own state plans. So what the state did is they delivered a certain amount of medication to the health departments, a smaller amount, and a much larger amount to the hospitals right at the very beginning, intentionally to get to these frontline workers. So that's what we did first. We had a large-scale clinic set up over in our Avery Education Center. We repurposed that building, and we used Epic, our electronic medical record, because one of the constraints, one of the hardest parts of this is you have to report to the federal government nearly real time who's getting vaccinated, when they're getting vaccinated, and things like that. So we advertised to our frontline staff, and we started working them through over 3 or 4 days. On any given day, as many as 500 people were able to get through Avery. And this whole workforce is a volunteer workforce. We didn't have a magic COVID clinic sitting there, so we had to spin it up fairly quickly using those IS and IT resources, our communication resources, getting nurse volunteers to do the vaccinations, other non-clinical registration type volunteers. So the amount of people that came together, including all the leadership and then all the managers and directors to make sure the messaging was strong to get folks vaccinated, was just incredible. And we've been very successful. Very, very successful. I think the most interesting thing for many of us, I think I was telling you earlier, when the first dose of vaccines came up from pharmacy, the whole room erupted in a huge cheer, because it was the first time that we had a chance to say, wow, there's hope in front of us. We really had something positive to look forward to, knowing the vaccine would get us to a place where we're able to live a more normal or post-COVID world.
Right, I know. I was talking to Dr. Joyner, who's in charge of research over there, and he's just very excited because he said this is our way out, and it is. You mentioned, I call it herd immunity, but you're saying people are calling it community immunity?
Yeah, you know we need to get to about 70% of the community vaccinated for us to be successfully away from COVID. So we have a long way to go. You know, the supply, it's hard to make this much drug this quickly, and I completely appreciate that. And get it out and have people understand and get their second vaccine if they need it. So yeah, there's a lot of logistical steps. But we've been very successful, hospital systems, healthcare systems, health departments, in doing flu vaccine and flu drive-throughs. So it's in our skill set. It's just being able to leverage that with some of the challenges of a very cold vaccine, if it's the Pfizer vaccine, and some of the other requirements for it. So.
And do you have the Moderna as well?
We do. We have both vaccines coming in. So we do have a very cold freezer that we're able to keep the Pfizer in, but it does take a little bit longer to produce, and it's only stable for a little bit of time. So all of those constraints just make it more challenging.
But it's there, and it's just a little slower going than I think people just assume. But it's a major undertaking, and then to make sure you're being fair and equitable. And I know one thing, when I talked to Dr. Snyder about it, he wants to make sure people understand that frontline workers just doesn't mean doctors and nurses, that it means your environmental staff, the people that are cleaning the rooms that are high risk for contracting COVID. So I don't know if you want to comment on that and make our community aware that it definitely is encompassing a lot of the workers in the hospital.
It is. We've been very happy. Security, I'm trying to think of all the other, there's so many jobs in a hospital. Our IS folks, our contractors that go in rooms to fix things. I mean, so many of us might think, oh, I work in an office, but we have so much exposure to the community, and we need that infrastructure of our healthcare system secure so that we can then keep taking care of the patients who are still coming in while setting up a lot of this opportunity to vaccinate the community. So yeah, I'm very proud of what Tidal Health did, of really saying we want everyone in our healthcare system to be able to get that vaccine.
Now, I know you and I can speak from personal experience that we both have had the vaccine, and I hardly had any problems with it, just a little achiness in my arm. Now, I know some people can have side effects. What are you seeing? I mean, are you seeing most people doing fine with it? Because I know there's a good number of people that want to wait and see how other people do with it.
Yeah, so a couple things that, for the first vaccine, for both vaccines, when you come to the clinic, you have to wait 15 minutes because there was a lot of news and press about a severe allergic reaction. What we're seeing is that's happening about 1 in a million times, so knock on wood. We haven't seen that in our clinic. We have seen people very anxious, very nervous about getting it at all. There's a lot of emotion about just receiving the vaccine, so we have seen a little bit of that. We have stretchers, we have some nice reclining chairs for people. So we do make people wait for 15 minutes after getting the vaccine, but we haven't seen any problems in the clinic. So then the next problems that people worry about are these more longer term 1 day or 2 day symptoms. And the CDC, in fact, for everyone getting the vaccine has a little QRC code. You can go on and register with their site to talk about your symptoms because they want to track that. Sure. So we're encouraging everybody getting a vaccine with us to do that. I have after the first vaccine, same thing. My arm was a little sore, but having been in the military, I've gotten a lot of sore arms from a lot of shots, so it wasn't any worse than that.
Well, it was much easier than shingles, because I got the shingles vaccine, and my arm hurt for a while from that. But, vaccines are important. They save lives. They, prevent disease. So I was more than happy to put up with a little mild ache in my arm. But and so far, so good. Now, I haven't gotten the second shot yet, and I've heard, some people say that the second shot, you don't feel quite as well.
I got my second one. I had absolutely nothing more than that same sore arm, but I have heard a couple people feel a little tired, a little fatigued. Many people say, oh, well, it's better than having COVID. But it's showing that that's the immunity response. Your body's saying, hey, I'm helping build immunity to that, and it's just hard for people. But I haven't heard anything problematic from a longer term scale than other than a day or two of just feeling poor.
Yeah. Well, it's part of protecting yourself, protecting your loved ones, helping with that community immunity. I want to do my part because I feel like it's just so important for all of us to get out of this mess. We don't know the long-term effects of COVID, but we do know it can make some people very sick. People have died from this. especially our older adult population is not faring as well as other people with comorbidities. It's just really important that we try to all do our part. And speaking of doing our part, I know we wanted to remind people that they still have to keep doing their part with the mask, the physical distancing, the hand washing.
Yeah, there's no magic. I got my shot, now I don't have to do any of that, because we all just have to, there's not enough of us who have had a vaccine, and we still have such a challenge ahead of us to get through this. So I think the other important part is you can't let the other parts of your healthcare go. One of the great parts of COVID is more people got vaccinated for flu, and we've seen much less flu in the community this year, which is exciting. But it's also important to get your annual physical, to follow up for your chronic diseases, to take your medicines, call your doctor if you have worries, because we've seen the utilization of healthcare resources went down dramatically.
And screenings as well,
screenings
right?
And that's the hardest part. Get your mammogram, get all those tests that you need to have done. So we can't let COVID rule us in all our other healthcare issues in any way. So that's really important that people don't forget to do all that.
And I think just reiterate that the flu vaccine does not protect against COVID, because I've heard that mentioned by some people. I got my flu vaccine. Well, this is a different virus.
Just like measles, mumps, rubella, and many of the other childhood diseases that we often get one vaccine and don't have to get those in our adulthood. Yeah, COVID and flu are very different, but you need both of them.
Well, the flu, I guess, part of it is it didn't tax our hospitals, which are already burdened with COVID patients. So to add flu on top of that, so thank goodness, that's good news that people went out and got vaccinated for the flu. I always have to anyway, being a nurse and so forth. But it's nice to hear other people followed that recommendation. Now, I know we also want to wrap up by saying, get your information from reputable sites. There's a lot of misinformation circulating out there about the vaccine and about COVID in general. So what are some good websites people that can go to, other than the Untitled website and the health department, of course?
Yeah, I mean, your local health department and hospitals are great because they refer then to other national websites. The CDC has some wonderful information, and for patients, for caregivers. The World Health Organization has larger stuff to understand that. I think the Johns Hopkins website does a great job with talking about the volumes of COVID and the infection rates and things for people who really want to see those statistics. But I think the CDC website, especially now as we're moving vaccine out, I think the State Department of Health website in Maryland and in Delaware is very helpful because it talks about what the state plans are, and you can read some of that information to understand where do you fit in the timeline of who's going to get their vaccine. So that's really good information as well.
Well, again, maybe reiterate the importance of considering the vaccine. It is a personal choice, and yes, we don't know the exact long-term effects of the vaccine, but we also do know a lot about the short-term effects of COVID. And I read articles every day about things they're seeing that could be problematic, that people that have COVID and recover still have some lingering problems and symptoms, and we don't know the long term of that either. So I don't know. I just feel like I want to achieve this community immunity so we can get back to normal, or near normal. They say near normal.
Yeah, I think we've learned so much, and we have changed the way we do many things now that some stuff won't go back to normal, and I think that's kind of okay.
Yeah, some of that might be good. People understand the importance of hand washing and things like that.
Maybe wear a mask, don't go to work if you're sick, things like that.
Exactly. Well, Kathy, thank you so much for coming on the program. It's quite informative. And like I say, this population health, it seems to be a very important focus. And certainly with the emphasis on collaboration and just keeping people healthier as we move forward.
Absolutely. And I know we've heard it a ton of times. We see it, #BetterTogether, but we really are better together, and this is an amazing community here on the shore. So I am ready and willing, if all of you are ready and willing, to wash my hands, wear my mask, get my vaccines, so we can have a fabulous summer, and winter and Christmas 2021 will be a very different thing.
And thank you for joining us for this edition of Focus on Health here on PAC 14.